Hello, I am Sabela Lens. I am the current secretary of the Spanish Association for the Study of the Liver, and I am very pleased to welcome Professor Thomas Berg, who is the secretary of the EASL Association, to be here today at our national meeting. Thomas, you have given an excellent talk about strategies for early detection and prevention of liver diseases. What do you think would be like the main three messages that you would give to the members of our society on how to improve on this matter?
Yeah, well, I started with the EASL Lancet Commission that really asked for a management change, that we should not focus on advanced, or let's say treating and the complications of advanced liver disease, but really starting from the beginning, and that we have a case finding of early diagnosis of chronic liver disease and then treat them in an appropriate way. But this is a long way to go, I think, and we have to work together with primary care physician, and we have to establish rules. But therefore, because this is also a more political decision, I also focused what can we do now as physicians, and I showed that in viral hepatitis we were quite successful because we have a very good test. We could check for viral load, and then we say, well, if we get rid of the viral load, then we have something achieved. And it's less clear whether we should do it in a similar way for liver function tests like ALT and GGT. But I think, and this is what I wanted to show, that we have good evidence that in all the other diseases, as long as we are able really to improve liver function tests, then the long-term outcome is most likely very good. So if we go to primary care physician and they find elevated ALT, they should aim educating the patient, perhaps you drink too much or I don't know, and to see whether by that they can normalize. If this is not the case, I think then we need a specific referral, then to make a diagnosis and start treatment.
You also made an important point about the stigma that patients with liver diseases have. How can we improve that on the general society? How can we, extend the knowledge of the causes of liver diseases to really start implementing changes even in infancy?
Yeah, well, I think the stigma really comes from the association of liver disease and alcohol. And I think we were part of it because we called it alcoholic liver disease, we called it non-alcoholic fatty liver disease. Also fatty liver doesn't sound quite nice. And if you compare it with cardiologists, they would never say it's a smoking-related cardiovascular disease. And we know that in many patients, it's not only the alcohol. There are genetic factors, there are other obesity or so. It comes all together, and only to stick on this one etiology, although in some patients, of course, it's a driving force, but not in all of them, would be important. And here I think we really have also to educate ourselves, because we have the stigma in us, and quite often physicians do not treat patients with liver cirrhosis in a similar way as compared to patients with other diseases. And we have seen it during the COVID crisis, when physicians were less willing to transfer patients with advanced liver disease, especially if it's alcoholic advanced liver disease, to an ICU if they had COVID-19. And yeah.
Completely agree. Thank you, Thomas. Thank you very much for your time.
Thank you very much.